And welcome back once again. It's Medical Monday, and today we're talking about Gynecological Cancer Awareness Month with the East Cooper Medical Center. East Cooper is ABC News 4's hospital expert, and Dr. Lori Stickler is here to discuss the prevention of those cancers that affect women. How are you today?
I'm doing fine, thank you.
Good, good. Tell us about some of those cancers that are mainly affecting women, but possibly could be preventive with certain tests.
Well, the big cancers that we see in gynecology are ovarian cancer, uterine cancer, and cervical cancer, and then some lesser ones, vaginal and vulvar cancer. The big one that we deal with on a daily basis is cervical cancer, and we can prevent that by early detection with Pap smears and finding early signs of cancer being there.
Now, Pap smears have changed tremendously over the years. At one time, they were a little bit painful. Now, not so much to speak.
Right. The pelvic exam in general should not be painful for patients. It might be uncomfortable, but it shouldn't be painful. And I think just talking patients through it really helps with that. The biggest changes that we've seen are frequency of Pap smears. You know, we all learn from our moms, when you turn 18, you get a Pap smear, and you get them every year for the rest of your life. And the guidelines are changing, and they've actually changed a couple times in the last few years. So it's even sometimes confusing for physicians to keep up with it. The biggest things to remember is nobody needs a Pap smear until age 21 now.
Okay. Is that across the board, or if you have a history of family cancers, would you do that earlier, or do you really need to be aware of that?
The biggest thing is cervical cancer is not a hereditary cancer for the most part. Different than endometrial, breast, ovarian, those can all certainly have a genetic link to them. Cervical cancer is more from exposure to the HPV virus. So theoretically, young ladies shouldn't really be getting exposed to that until, you know, adolescence and their teen years, and then therefore you don't have to start screening them until 21 when problems might start to show up from it. Now, certainly if you had a young lady who came in with symptoms that made you worried about cervical dysplasia or cancer, you may want to surveillance them earlier. But now they don't have to start until 21. We can stop at 65. You can stop after hysterectomy depending on the reason why you had your hysterectomy and if your cervix is still there. And then the frequency of Pap smear has really changed a lot between the 21-year-old and the 65-year-old, such that you don't have to get them each year.
But once you start getting them, you usually get them each year.
Now in the 20s, you can go to every 3 years.
Okay.
And in your 30s, you can go to every 3 years or every 5 years if they do an if your doctor does an HPV test with it.
And that is such a great way to do early detection on different cancers that are there. If someone were not to get a Pap smear for a number of years, what would be, and unfortunately sometimes when we do have cancers, it's too late, it's already there, it's already starting to do its work.
Right.
And what are some of the signs, some of the symptoms that maybe a young lady, an older lady would see?
Well, with cervical cancer, one of the biggest complaints is bleeding after intercourse, an unusual vaginal discharge. You might also see pelvic pain or changes in bladder or bowel function. And that's why I think one thing that's happened with the change in Pap smear guidelines such that you can space the Pap smear out is oftentimes women forget that you should still come in each year for your exam. And that way we can at least still feel and look. You might not have to get the you still need the speculum part to be able to look, but you don't have to get the Pap smear, but you still need to feel for the ovaries, feel the uterus, things like that.
So this is one of the main symptoms of ovarian cancer.
Well, with ovarian cancer, you can still see changes in bowel and bladder function, a lot of times fullness, bloating, gas, nausea. So a lot of common complaints with GI disorders. And since ovarian cancer is more common as women age, and so are GI complaints, they can be very, very confusing. So that's particularly why it's important for women to come in each year so they can get their exam and make sure their ovaries don't feel enlarged.
The examination takes just a little bit of time, a few minutes. What are some of the preventive precautionary measures, such as not drinking alcohol or certain amounts of alcohol, and of course smoking as well?
Smoking, particularly with all cancers, but particularly with cervical cancer, you can reduce the likelihood of it or see dysplasia precancer reverse with cessation of smoking. Certainly alcohol consumption with most cancers increases your risk, so alcohol in moderation. Unfortunately, with ovarian cancer, there are not many preventative things. Birth control pills can actually help prevent it. If you have a family history, being checked for the gene mutation associated with breast cancer can also have an increased risk of ovarian cancer. So if you have a family history, having that test done can be helpful. With Pap Smears, the HPV vaccine that's available now, or I'm sorry, with cervical cancer, the HPV vaccine can really reduce the risk of that.
Okay, Doctor, thank you so much.
You're
Some
very welcome.
great information. Remember, you can find more information on this and other topics on abcnews4.com/experts. We're back in a moment.